welcome to part 3 of our the Chamber of Commerce's Government in Focus series. Today we have the state of the county. These addresses are sponsored and were created by our Governmental Affairs Committee, and we thank all of the members of the Governmental Affairs Committee for helping put these things together. Today, as I said, it is the 2025 State of the County, and I am going to bring up Mark Shahan to get us started off.
Thank you. Well, Marie's worked pretty hard. I'm Mark Shahan, presiding commissioner of Adair County, and we've worked really hard trying to get people engaged in this. We have people here that's not been here for a while, but we have others that should be here that aren't. So we're a little bit disappointed, but we're going to do what we can and give the report on what we have, and I think it'll be a good meeting here. So I got something wrote down here that states facts. I can talk, but I can't remember all this stuff. So I'm going to read from this document we've put together here, and then if anybody has any questions, don't be afraid to ask, and we can move on. So the state of the county in 2025, the Adair County Commission has approved the budget and has been prepared by the county commission. The budget process factored in the current economy and objectives of the elected officials. Adair County has seen an increase in general revenue fund, road and bridge fund, law enforcement fund, and it's also included monies from the ARPA funds that we added to some of these to help make the county more successful. 2025 budget includes all the necessary funding for the county departments to provide quality customer service to the public. It also includes federal and state grants, funds for multiple services. The county commission is budgeted to expense the remainder of the American Rescue Plan Act, their ARPA funds, this year. A 3% COLA was approved by the county commission for all employees. Elected officials will also receive a 3% COLA to comply with salary commission guidelines. The county continues to fully fund the logger's pension plan, 1/2 of the SURF pension plan, and the prosecuting attorney's retirement plan. In addition, Adair County offers a health insurance plan with a predetermined cost to all eligible full-time employees and elected officials based on their choice of coverages. Adair County continues to collect a quarter-cent sales tax passed by the voters in April of 2021 to finance the restoration of the historical Adair County Courthouse. As of December 31st, 2024, the balance of the outstanding loan is $6,121,000. The loan is scheduled to be paid in full on or before September 1st, 2032. Now, we've discussed this. We're seeing some more revenue than what we anticipated. So, if we can pay this off at an earlier date, we'll sure make that effort to do so. Adair County would like to welcome the newly elected and re-elected officials whose terms began on January 1st, 2025. The newly elected 2nd District Commissioner, Gayla McHenry, Sheriff Jason D. Lean, Patrick Bourne as surveyor, as well as 2nd Circuit Judge Matt Wilson. Matt Wilson had originally been appointed in 2022 by Governor Mike Parson to fill the unexpired term of the Honorable Russ Steele upon his retirement. Re-elected officials include 1st District Commissioner William King, Public Administrator Ron No, Coroner Brian No, and Assessor Kent Bryan. The budget law requires a detailed and precise compilation of the budget document. It is overly complex law, and our goal is to create a fiscal document to provide services to the citizens as well as visitors to Adair County. The Adair County Commission wants to thank all the elected officials and staff for their efforts compiling the 2025 budget. Reminder, Fund 907 Juvenile Justice Center is not included in Adair County's main budget document. The budget for Juvenile Justice Center is included separately at the beginning of the budget document. Adair, Lewis, and Knox counties contributes $134,200 maintenance of effort, which is the obligation from the Juvenile Finance Agreement. All other funds are passed through for the 2nd Judicial Circuit, and juvenile justice funds merely expend revenues deposited with the county treasurer. These funds are not included in the operating budget of Adair County. Some of the positive accomplishments of the County Commission in the past year are closing out of the FEMA project 4741 in the amount of This was a result of the storms that we experienced in July and August of 2023, which dumped up to 12 inches of rain overnight. Some improvements were in the county with the completion of 3 bridges, which are on county roads: Turkey Run Trail, a VRO funded bridge, which is federal money; Missouri Trail and Wilmsville Schoolway, which were built with ARPA monies. Other improvements were applying maintenance rock in the amount of 100 ton per mile on all gravel roads. This action resulted in applying 3 times the aggregate that the county has applied in the past. All these improvements are in line with the Commissioner's goals to provide better services to the citizens. The Commission is looking forward to another great year here in the county with the Farmers Market, Nemo Fair, Summer on the Square, Red Bar, and many other festivities planned in 2025. Kirksville Winter Lights and the Hometown Holidays made quite a show with the decorations and festivities during the holidays, which will be even better this year. The County Commission wants to encourage all to take the opportunity to enjoy our community's festivities this coming year and wishes all to have a great year. Thank you for coming today.
So we're going to go in alphabetical order today by department. So that means that I'm going to introduce Lori Duffy from the Adair County Health Department.
Thank you. Good morning. Like Marie said, my name's Lori Guffey, and I'm the administrator of the Adair County Health Department. And I began taking the position a year ago in January of 24. And I just want to tell everyone that the mission of the Adair County Health Department is what we call the 3 Ps: to promote health, prevent disease, and protect the public. We continue to serve the public through our various programs. We have the clinic services, communicable disease surveillance, which I do that, vital records, which is birth and death certificates, WIC, environmental services, and emergency preparedness. A year ago, we added our community health and education department, and that enables us to go out into the community and provide resources for the community, do a lot of educational events, and so we're proud that we have added that to the health department. I want to talk about the accomplishments. Last year, we were in the process of having our building annex completed, and it is now completed. We had an open house last year in September, and that building annex is very important to us. We're very proud of that, because that enables us to continue practicing for mass dispensing exercises in the event that we would have a pandemic, which I hope we never have that again. But we used to have to go out to the fairgrounds and administer flu vaccines, but last year we were able to use our annex building to give flu vaccines, which we will continue this year. And it's a wonderful building. We're very proud of that, and so I welcome any of you to come out and look at that building. We have, every 2 years, we are required to complete a community assessment, so we have completed that, which involved having community focus groups that they communicated to us what they felt the needs were in the community. So as soon as we have that data, we will share that with the public. The future plans for us is to focus on a public health model, which is basically getting back to the roots of public health, where we promote health, prevent disease, and protect the public. And we try to do that every day through all of the services that we offer out at the health department. Currently, we are sending out, and I hope we continue with that, a newsletter that comes in the mail. It's called the Adair County Health Department Quarterly, that just tells the public about all of our services. I know that there are services out there that people, they don't even know that we do, and I'm going to leave our annual report back on the table of the services that we do, so anybody can look and see. We're really excited this year. We're able to participate in Public Health Week. It starts on April the 7th, and it goes through the end of the week, and we have lots of events planned. We have low-cost lab that we're going to do, vision screenings, things like that, and I will leave the flyer in the back because we weren't able to do that last year, but Public Health Week is very important to public health. So with that being said, we're very proud of our services. I'm proud of the health department and the employees that we have, and they get out there every day and protect the public. Thank you very much.
And we have a new director of the library. I'm going to allow her to introduce herself and give us a little background, if you will.
Oh, okay.
And as well as an update on, because I'm sure that you are just dove right in and
Yes.
you know everything there is to know.
Right.
Right. I get it. Anyway, now for the library.
Thank you. My name is Susan Knox, and yes, I'm the new director of the Adair County Public Library. I've lived in Adair County for the last 21 years with my husband, where we have raised our two sons who attended our public schools. I like to say we have two juniors. We have a junior who's still in high school, and we have a junior in college right now. I worked in the schools for 10 years and then took some time off this last year to decide what I wanted to do when I grow up, and I found out. And yes, I'm quite new. So, last week when the county commissioners first invited me to speak today, I had 3 immediate reactions. The first was fantastic, an opportunity to speak about the library and how we serve our community. The second was fantastic, an opportunity to meet other folks in our community who share a commitment to serving our residents. And my third reaction was panic, pure panic. Because you see, I met the commissioners on my 12th day on the job. I am still going through the files of my predecessors, learning the workings of our organization, and just starting to analyze the numbers. Much like a new reader who is not yet fluent, I humbly acknowledge that I am not yet fluent talking the library talk. But, much like a librarian, if you have any questions that I cannot answer, I will do the research and find the answer. Today I want to look both forward and backward. I want to look back at some of the accomplishments of the Adair County Public Library during the past year, and I also want to look forward to some of the plans we have and some of the work we need to do in the coming years. The following data comes from our 2024 Public Library Survey, which we submit to the state every year for approval. Looking at the finances, the library stayed on budget with our total operating expenditures at $514,373. 85.23% of our income came from local tax revenue, and 7.72% came from state aid, while 7.04% came from other incomes such as donations. According to the audit report we just received last Thursday, we have been good stewards of the taxpayers' money and remain in good standing. Librarians cannot resist talking about statistics, such as circulation numbers and catalog holdings. I am no different. We circulated 173,052 items last year. This includes physical items like books and DVDs, periodicals, and interlibrary materials. We added 3,433 items to our catalog, and we issued 884 new library cards. We circulate or check out an average of over 2,000 digital resources each month. The Adair County Public Library put together over 400 programs in 2024. We continue to offer programming for residents of all ages. Our program patron count in 2023 was 7,301. In 2024, our program patron count was 9,147. That is an increase of 1,846. We continue to provide a multitude of services to the residents of our county, including but not limited to free Wi-Fi, computer access, printing and faxing services, and interlibrary loans. We also provide homebound services for our residents who are unable to come to the library. Currently, we regularly deliver books to 30 residents in the county. Children's programming and early literacy efforts continue to be a priority. In addition to story time at the library, we offer an online story time to county residents who are unable to visit us. Our summer reading program promises once again to be both educational and engaging. Let's just say I heard there'll be a unicorn making an appearance this year. Looking forward, the library is no different than any department here today, no different than any family in Adair County. We are asking ourselves, how do we best stretch our budget, allocate our resources? Many folks have come up to me and asked if the library will be asking for a tax levy increase in the next go-around. The answer is no. During this time, the library intends to continually ask, what can the library do to help? We will work hard to remind people that we offer services and resources that can help folks stretch their budgets. We offer free Wi-Fi and computer access. Streaming services becoming expensive, we have free movies and TV shows on DVD and through online resources such as Hoopla. Replacing your printer cartridge not in the budget this month, we offer very inexpensive printing services. The mission of the library is to encourage reading and lifelong learning by providing recreational, educational, informational, and cultural opportunities to the residents of Adair County. We will continue to work hard to fulfill this mission. I want to thank the county commissioners for inviting me here to speak today and to share with you how the library is serving Adair County. Thank you.
Thank you, Susan. We're so excited that you're here. I love libraries.
Good, yeah. I do have application forms if anyone needs to update their library card.
Good thought, good thought. And now for Adair County SB 40, we have Sean Jacob. He is also relatively new to the role. So Sean, if you'll come back up and tell us a little bit about yourself and give us your report.
All right. Well, thanks for having me here. I'll have to let my kids know about the unicorn coming. They like to be part of the reading program, so they'll definitely be in on that. So, yeah, my name is Sean Jacob. I've taken over as the Executive Director for Adair County SB 40 for Crystal Aminirod starting in January. So, yeah, again, I'm pretty new, learning things. I think I may have had a little bit of more help. Crystal was pretty good about setting things up to be able to pick up the ball and take it from there. But it's still been a lot. We stay very busy. We've had a lot of things going on. So I'll do my best to stick to my notes, kind of give an overview of some of the highlights from this year, a bit about who we are for those of you who don't know our agency. And then, yeah, if there's any questions after, feel free to seek me out. So our agency's vision is to see our people's abilities, and so that they can live their best life. So that they can live their best lives. It's easy to initially just look at our people and think, look first at what their disabilities are, but our focus is to try and shift that way of thinking to look at what can they do and how can we help them live their best life. So how do we do that? We seek to engage through advocacy, inclusion, and resources, whether it be advocating with them at the school and IEP meetings, just all forms of advocacy as far as seeking the least restrictive type of guardianship situation. Let's aim for supported decision making as opposed to jumping to guardianship just because they have a disability, things like that. So advocating for what's best for them, inclusion, that they be genuinely part of their communities, authentically included, and then also making sure our people and their families have all the resources that they need, again, to live their best life now. As far as we have two different offices. We have our targeted case management main office, which is the DD Resource Center on McPherson Street. That's where all of our service coordinators are, our primary administrative staff and myself. Our case managers assess the needs of our people. They link them to resources, link them to the funding needed to access those resources, everything from assistive technology, medical equipment that's not covered by insurance. We can access alternative funding resources to get those. Vocational training, again, IEP and school support, healthcare support, home modifications, job supports, help with benefits, applying for benefits, Social Security, Medicaid. We're kind of the jack of all trades, master of none. We know a little bit of everything to be dangerous in all areas. And so again, it's as unique as each person is. We have 465 people in our services approximately now. Our caseload keeps gradually going up. We just had to add a part-time position just to account for the increased caseload. So we're advertising for that now. But with those increased needs, we're just trying to meet those needs as best as we can. So caseloads have been spread pretty thin, and we've had some turnover with staff, but for the most part, we're staying pretty stable. As far as the demographics of our people and our caseloads, just to give you some numbers, right now over the the years, we've approximately had about 30% of people that have autism, and then about 70% that have other developmental disabilities. Whereas with intakes that we're receiving, about 70% of them have autism and 30% other disabilities. So it just kind of gives you an idea of how our demographics are changing. And those are kind of consistent numbers over the past 4 or 5 years. Our other office, there's our targeted case management. That's most of our staff work on that side. We also have our learning center, which is on the south end of town near Colton's. And we have, community classes and events there, activities that are geared towards our people, but also community-wide activities as well that are open to all. Again, we want to be a resource to our community. We have a sensory room with a sensory swing in there that's open to anyone who wants to use it. It's really just call Melissa Klein at the Learning Center there ahead of time. And so again, it's a resource that we want to be open to our whole community. We serve 5 counties: Adair, Scotland, Schuyler, Sullivan, and Putnam County. We are seeing a higher, and I think this kind of is something that the school has also been sharing at their state of the educational side of things, a lot more higher behavioral, mental health, kiddos with trauma. A lot of our intakes have a lot more CD involvement, and that just, again, is maybe just a sign of the times we're in. But it is something that's changed the way we train and prepare our service coordinators. So we really have to have them prepared for trauma. So trauma-informed care, trauma-informed training for our service coordinators. We had them take a mental health first aid training to be kind of prepared for the types of cases that we're increasingly seeing. And then just a lot of other general challenging cases, everything from homelessness, medical emergencies, mental health emergencies, guardianship related situations. So a variety of challenges that we're facing, but again, doing the best we can to meet those challenges with quality services. We try to stay very involved with local and statewide stakeholders and community leaders and legislators. We're part of the local Kirksville Governmental Affairs, as well as the MACDDS, which is kind of the statewide body of TCMs. So try to stay involved with what's going on legislatively, changes that are coming, potential cuts on property tax and things that would impact us significantly. About 25 to 30% of our revenue comes from that tax levy, and then the majority of the rest comes from our billing of Medicaid for case management services. So that's one of those areas of challenge that we've faced is our TCM rate, as we call it, has not been increased since 2015. So you can imagine like how much has changed, inflation and cost of living wise in 10 years. And so that's a big challenge, not just for our TCM agency, which stands for Targeted Case Management. I throw a lot of acronyms around, so just in case you didn't catch what that stands for. So case management that targets people with disabilities. But yeah, it's a challenge to stay fiscally viable. And so we've had to kind of tighten our belts in some ways because of that lack of a rate increase. So it's something that we keep asking of legislators. The MACDDS Governmental Affairs Committee is always bringing it to the attention of legislators that it's a need, along with the DSP rate increase, which has been gradually going up. But TCMs keep getting left out of that. And so we have struggled. But again, we're doing the best we can to manage despite the lack of the rate increase there. We have we've updated our organizational structure to kind of try to increase efficiency. Again, with caseloads being higher, how can we be more efficient? We began using SetWorks in 2024, which is a case management software to, again, just help with efficiency in those areas. We added a community resource coordinator position to focus a lot on employment for our people, also to manage the majority of the non-Medicaid caseload, to kind of spread things out there a little bit, and again, just trying to increase efficiency. Our community resource coordinator has pursued some grant opportunities to help fund critical services, including transportation, housing support, food security, disability services, ensuring more people in our community receive the assistance they need. The CRC is representing our agency in trying to work towards building a kind of a grassroots volunteer transportation network in the area. Not something that we want to head up necessarily, but we want to help get going in whatever way we can, because it's something that will require strong community support and collaboration. And it would be it's a great opportunity, and it would meet a huge need, because transportation always comes up as one of the biggest needs in our area. And I think there's more than enough people who would be willing to volunteer. I mean, every time I talk about it with somebody, it's like, oh, I would volunteer for that. It's just getting it together. It's just getting all the parts together is the challenge. That's always the hard part. And then as well, our CRC has created a more efficient intake process, as well as just being available, a person who's available for our families who haven't fully gone through the intake process, because the Department of Mental Health manages eligibility in the intake side of things for our services. We don't do the intake. We can give people a good idea that, yeah, you'll probably be eligible, but we still have to direct them to the state, and then the state sends the referral on to us. And again, eligibility is based on a diagnosis as well as functional limitations based on the assessments that they do. But Tatiana, in that CRC position, has been able to give families some guidance and help in that application and getting eligible process, because it can be, they give you a lot of paperwork to fill out. That can be a bit of a barrier for services, so she can help them with that. And she's developed a questionnaire that they can go through that then gets forwarded on to the state, which just helps seamlessly work with that process. She's also developed a high school to adulthood support form, kind of as a triage system. This is a fairly new development with our the Transition to Adulthood Coalition that meets monthly, and that's to, in a practical way, because we have a lot of stakeholders that collaboratively meet to discuss that transition to adulthood, especially for our youth in high school. But actually having that be a time where we can do kind of like an echo symposium type collaborative meeting, where we can discuss some challenging cases, de-identify them, but present some of the challenges of that case, and then have everyone kind of discuss it together and what are some solutions. Let's kind of put our heads together and figure out what can we do with this kiddo who's looking to transition to employment, which is, again, the purpose of IDEA and what the schools are trying to work each of our kiddos towards. So kind of a triage system to help the schools identify and prioritize the needs of the students transitioning to adulthood. And she's been kind of collaborating back and forth with some at the school in relation to that. And again, that's still a fairly new development. SB 40 helped chair the planning committee for the 16th annual Community Engagement Conference, which was this past March 1st at William Matthew Middle School. I thought it was very successful. We had some pretty good attendance and participation from the community. Having it on Saturday is really rough, but it's also finding a place where we can have it during the week has been a challenge. So we had a keynote speaker, Letitia Wextetten, with the theme Imagine the Possibilities. And again, it was a very successful event overall. We had our recent annual Spotlight Award banquet, celebrated 12 Spotlight winners. We try to highlight people in our community who are doing amazing things, whether it's kids inclusion, youth leadership, community volunteers, and entrepreneur or employee spotlight. So any one of those 4 categories, whether it's our people or people who are helping to support our folks, we really want to highlight those that are really doing outstanding things in our community. And then we have an annual dinner that kind of highlights each of those folks, and they receive a plaque from our agency, as well as resolutions from the House and the Senate, with Lois Bragg, who was present to represent Cindy O'Loughlin from the Senate side, and then Danny Busick was present that evening to present from the House side. So it's just a really special, neat night every year, and we look forward to doing that. And for some of our folks who were there or weren't able to make it, but we brought them to them, there were tears and just a lot of appreciation at the recognition they received. We do in March as well, March is a busy month, our first grade readers activity, where our service coordinators and some of the other staff in the office go out and read books about kiddos with disabilities to help educate them about what understanding our people. And it's usually a very fun, engaging time, and we don't have a hard time finding volunteers for it. It usually, I think the email went out looking for volunteers and it was filled up in 3 minutes and 47 seconds. It was just like almost immediate. Everybody jumped in. And so that's a really fun event. We also participated in the annual Diversity Festival, We participated in the Heartland Task Force Daddy-Daughter Dance and plan to do that again this year, to have a booth there. And again, just helping children with disabilities to be included in community events by providing them with accommodations. We have some items usually at that to give out that kind of highlight and educate in that area. In September, usually annually, we have our DSP celebration of direct support professionals, the people who support our people, primarily, and really just try to highlight some excellent DSPs, and also just have a fun time where our people can also celebrate and show thanks for the great staff that they have. Our community engagement specialist, Melissa Klein, as well as our CRC, Tatiana Dixon, presented recently at the Northeast Missouri SHRM chapter, highlighting the importance of employing people with disabilities. We're also looking forward to the Special Olympics coming. That's a big thing for our area. We've already been able to sponsor for that, and we're planning on helping to volunteer as well. Some of the classes at the CLC, they have a Project STIR class starting again here soon, and that's steps towards independence and responsibility. And they also have a Circles class, which teaches on relational intimacy, boundaries, things like that. So just example of some of the classes that are offered there, budgeting, cooking, things like that are some of the classes offered. We had an open house November 4th to celebrate our 15th anniversary of the Community Learning Center. We collaborated with students from TSU's Health and Exercise Department to offer a fall and spring Exercise Your Mind class. We also collaborated with ATSU's IDD Club to offer a health fair, game night, and exercise class for CLC visitors. And again, CLC is Community Learning Center, our building on the south end of town. We also had a summer youth program, which is related to employment, ages 13 to 15, had a number of youth that were involved in that in the month of July, learning soft skills for employment, communication skills, volunteer opportunities, etc. So again, in summary, there's a lot of stuff. We like to stay busy, we like to stay involved. We want to be seen as a resource to our community. We love to help our people. Some of the challenges, threats of property tax cuts, which would impact us. Every once in a while, there's it seems like it's settled down, the concerns over Medicaid being cut. That would also significantly impact our people if there were Medicaid cuts. And then, the lack of TCM rate increase. Those are some of the challenges. But again, we do the best we can to control what we can control and address those challenges. So we greatly appreciate our community. We're committed to continue giving high quality services to people with disabilities, and appreciate our community and all the collaboration that we have with our community. So thank you. And again, if you have any questions, let me know.
We actually do now open it up for any questions that you may have for any of our presenters today. So if you have any questions, raise your hand, and I'm gonna let you guys field them.
Not bad.
No questions? All right, you guys have done a wonderful job of informing us on what's going on in the county. We really appreciate you taking the time out of your day to come and inform us about what's going on with the county. We will have the video online on our YouTube channel, and I will also be uploading it to Facebook. For those of you who know people that could not make it today, they can go online and get our comments, get the comments. So that's another service that the chamber offers. So I really, again, appreciate you all being here. I appreciate you being here, and this concludes our State of the County address, and I'm sure that you guys will hang around in case somebody has a question that they just didn't want to raise their hand on.
Thanks, Maria.
Thank you.